26-year-old Nina Pham was part of the medical team that treated Thomas Eric Duncan. 2 days after his death, the nurse developed a fever and on Saturday tested positive for Ebola.
Yo, what's up world? It's your buddy Philko here, and I'm reporting live from Yekaterinburg, Russia, and oh my god. Look, I know it shouldn't matter who got it or how pretty they are, but damn, this girl is gorgeous. Fuck you, Ebola. Go to fucking hell messing with the fine ass chicks fucking shit up for me. The chick is not gonna be the same if she survives, which I hope she does. But she ain't gonna look this damn good afterwards. There are probably still some guys who hit on her now. Even though she got Ebola, they're like, fuck that, you know, I ain't got no competition, I'll go for it. Give me the shield, gloves, and a mask. I'll walk right in that bitch, be like, yo, let me get your number. And hurry up before it's too late. Still guys who'd hit on her. She's fine as hell, Nina Pham. Now Nina Pham has, she caught Ebola. She's one of the nurses who was treating the guy, one of the first guys who got Ebola. So, and apparently according to the CNN article, you know, let me back up a little bit, let me back up. The nurse wore a mask, gown, shield, and gloves as she helped take care of the dying Ebola patient in Texas. She took all the precautions. She did everything she was supposed to do. And a day after the Centers for Disease Control and Prevention said she tested positive for Ebola. Health officials are still trying to figure out how exactly she caught it. Now, I don't want to hear none of your perverted jokes in the comments. Like she was probably doing thing with the black guy who had Ebola. I don't want to hear those nasty shits. She's a beautiful, nice lady. I hope she pulls through. You understand? And it's natural to feel a little more sympathy for beautiful women than a man or a non-beautiful woman. No, it really is. I'm dead ass. It is. So don't think I'm an asshole because I saw her and my heart just broke. It really just broke. Now, of course, I see black people getting it and I don't like it either, but a beautiful woman to me, that's more than just somebody of your race. Fuck that. A beautiful woman I can create with. You know, make more beautiful kids, and she's smart too. She's a nurse. That's good for evolution right there. Both of us together have a good ass kid, you know, so I feel for her. Something went wrong and we need to find out why and what, said Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. The woman, Nina Pham, took basic precautions while treating Ebola-stricken Liberian national Thomas Eric Duncan at a Dallas hospital. Now she's the first person to have contracted the deadly virus in the United States. There are a few details that are known about what might have gone wrong. Yo, I hope she did not hit the club after she was taking care of that dude. I hope she did not hit the club or nothing like that. I'm serious. I really hope she didn't. I hope she wasn't like giving dubs and shit like, come on, yeah. I hope she wasn't doing it. There's gonna be a lot more people in bad situations if she really did do that. I hope she didn't go anywhere. On Monday, Dr. Tom Frieden, director of the CDC, told reporters that it's still unknown how the infection occurred. Only that a breach in protocol for treating a patient happened. So basically she did something, or possibly did something, during taking care of this patient that she wasn't supposed to do. Keep your perverted jokes to yourself. I don't want to hear it. I know I got perverts in my goddamn comments, and even I got jokes in my head, but I'm not doing it. This is serious. It's a beautiful woman who has Ebola, and it hurts me personally. All right. Last thing for the article. Frieden said state and federal health officials are re-examining those protocols, including the removal of protective gear after contact with an Ebola patient, and if it might be helpful to spray virus-killing solution on workers as they leave an isolation unit. He said Monday that the nurse is clinically stable. Well, that's for now, because it seems the mortality rate is what? What are the odds of you surviving? Let's say what the odds of you surviving this thing. I think it's like, what, 70% or something? But anyway, you guys can look it up. I personally, I'm gonna lie, I don't know much about Ebola because I'm not really worried about it. Maybe I'm just ignorant as fuck. But if you are worried about it, like I said in my last video, you need to look up things, you need to research it, find out for yourself. Don't just trust the news. You know they just want to scare you. I'm not gonna sit here and pretend like I know. I don't know, but it doesn't scare me that much. Not yet. I guess it has to appear in Russia or something, then I'll be scared. But it's not here. I haven't heard about it in New York, really, you know, so I'm not really worried about it. But anyway, people, that's basically it. I hope this lady pulls through, and I'm out. Later. No perverted jokes. Okay, go ahead, perverted jokes.